This video today is going to be a conversation about one adult patient's experience of Tourette syndrome and a treatment called Deep Brain Stimulation, or DBS. This video doesn't constitute medical advice, and you must see a health professional about advice regarding treatments and medication. But thanks so much to Jason for joining me today, and we're going to have a conversation about his experiences. But it's always good to have a quick introduction into what Tourette syndrome is. So I'm going to do that, and then we're going to start talking and discussing, and I've got some questions to put to Jason about his experiences. So what is Tourette syndrome, or TS? It's an inherited neurological condition, and it affects one school child in every 100, and it's more common amongst boys. So it's not rare. We believe that over 300,000 children and adults in the UK are living with Tourette syndrome. And the key features are tics, so involuntary sounds and movements, which have to be present for at least 12 months to meet a diagnostic criteria. But there are, of course, just tics in general, and also other tic disorders like chronic tic disorder and transient tic disorder. An important feature about Tourette syndrome is that around 85% of people with Tourette's also have a co-occurring condition. So this is often attention deficit hyperactivity disorder, or ADHD, or obsessive compulsive disorder, which is OCD, as well as anxiety, depression, sleep problems, and we'll talk about some of those as well. One of the main things about Tourette syndrome also is that it's often misunderstood. There's lots of stigma around it, and people often believe that it's all to do with swearing. But in fact, only about 10 to 15% of people with Tourette syndrome have a swearing tic, which is called coprolalia. And so 90% of people with Tourette syndrome do not have coprolalia. And in a small number of people with Tourette syndrome, the tics can be so severe and extreme that the available treatments, such as medication or behavioural therapy interventions, don't reduce tics, and they don't respond in reducing the tics or the frequency. So there is this option of neurosurgery called deep brain stimulation, and it's been used on patients to help reduce their tics. It's not been available as a treatment on the NHS in the UK sort of far and wide, but there are a series of new clinical trials planned, and other countries offer deep brain stimulation to patients as well. So that's a kind of quick overview, and I'm really keen to sort of put some questions to Jason and hear about his experiences. So thanks for agreeing to speak to me. Can you start by telling me a bit about yourself and what kind of journey you've had with Tourette syndrome? Obviously, you're an adult now, but can you sort of tell us when it started, when you were diagnosed, what kind of tics, etc.? That would be great.
No problem. So I think that I first started, well, my parents started noticing myself twitching when I got excited from the age of just before I was 3 years old. And it usually came when just before I was eating food. Food was a big part of my life. So just before I get lunch or tea, I used to start twitching with excitement. And from there, it got progressively worse, to which it wasn't until I was 13 years old that my mother referred me to a hospital called Booth Hall Children's Hospital in Manchester. And now Booth Hall specialised in kind of disorders and behavioural therapies for children. It's no longer there anymore, and it took them 1 year to diagnose me with something which my mother knew I had already, called Tourette syndrome. It got progressively worse as I went through puberty up until the age of being 19, when I think it peaked at its possible worst, and a lot of my tics focused around the face, the neck, and upper body. So like jerking my arms, twisting my neck. I used to constantly get disorientated, get dizzy. So it was stages where I had to go up and down stairs on my knees. It used to take me 15 to 20 minutes to brush my teeth because I was flinging the toothbrush everywhere. So I was in quite a bad way. And moving a bit further onto the journey, going into how I actually found around deep brain stimulation, it was actually by chance. I was looking online because I've spent a lot of my life on medication, been over 30 different drugs, and they're all from the antipsychotic branch of medication. And a lot of them, for me, give me equal but potentially worse problems than the Tourette's itself did. Spent a lot of my life sleeping, unable to communicate. Now, I don't know if this goes for everyone with Tourette's, but with myself, I tried to avoid socializing into unless it was a small group of friends who I knew very, very well, because you're always going to be self-conscious. How do my tics appear to other people? And that's something that you cannot get out of your own head from a thought process. And from researching different methods of dealing with Tourette's or cures, I stumbled across deep brain stimulation. And it was an article that was in the late 90s from America. And back then, that was when the surgery was completely different. And there was a lot of risks that I read online. But I spoke personally off my own back, spoke to one of the neurologists at Salford Royal NHS, which was my nearest place who could deal with this sort of thing and give me advice on medication. And it took me 3 years to get onto they actually have the surgery, because I had to do a number of clinical trials in terms of cognitive behavioral, different moving blocks into different places. And I know a lot of people think, well, were you nervous before having this? And for me, no, because I had nothing to lose. I was single. The only thing I did have, I used to have a ponytail right down my back into my rock music. Obviously shaved that off for charity. Can't go back now. But I wasn't nervous at all, because for me, even if it didn't work, I was taking every chance possible to remedy what my issue was.
And so it was really, it sounds like nobody suggested this to you. It was you researching it and finding out about it from other countries.
Exactly. That's exactly what it was. And I didn't tell my mother I was having it done until 10 days before the actual procedure.
Okay.
And my father didn't know anyway until after I had it done.
We'll come on to that a little bit, but why, can you explain just briefly why you didn't tell them?
So at the time, I mean, I enrolled when I was 19, had it done when I was 23. And the reason why I didn't tell them is I was quite secluded. I like to keep my own medical things private. I think that's one thing that I've noticed with my Tourette syndrome. When I was quite bad, I wanted to keep my business my own, and because in terms of explaining stuff, that was a challenge in its own right, trying to get the words out and try and say something, because as soon as Tourette's pops into your mind, that's when I used to twitch 10 times more than what I used to. So everything became 10 times the effort, be it because I used to play guitar, but I'd stopped that for many, many years because the tics were too bad. Speaking, reading, writing, everything just became 10 times harder than what it should be.
So basically every part of your life was being affected, and the medication wasn't having an effect. Were you offered behavioural therapy, or that wasn't an avenue that was available perhaps?
So there wasn't too much availability when I was in and out of hospital for trying. I mean, I did some CBT stuff, cognitive behavioural therapy, sort of those elements in terms of different ways to control the tics, but everything just made me 10 times worse. I also saw a psychiatrist, and this is going back well before the knowledge that we have now, to which case there was special tapes made to help me relax. And as soon as the word relax is mentioned, I used to twitch 10 times more. So I just, there was no route for me.
Yeah, it certainly doesn't work for everybody, the medication or the behavioural therapy as well. So we should probably kind of explain a bit about what deep brain stimulation is. Can you give us a description of what it is so people can get an idea? Oh, now I can't hear you.
Sorry, that's myself, put myself on mute, because I tend to cough a lot as I cover up still. But so from my understanding, from the research I did and what was actually done to myself, I understood deep brain stimulation at a high level to be two very, very thin rods which go to the thalamus in the brain. And you've got electrodes each side, and each electrode can essentially be programmed to a frequency, an amplitude, and a voltage, which stimulates that part of the thalamus. And obviously, I knew that wires would come up and over the skin. You may be able to see on the camera over the skin into a computer in my chest, which is programmable. So that was my understanding. It's kind of a concentrated electric impulse, essentially.
Mm-hmm. And it's been used in other conditions like Parkinson's, sort of first of all, hasn't it? But yeah, that's my understanding as well, that there are implantable electrodes, and also you mentioned a computer or some kind of pulse generator with a battery, I guess, under the skin in your chest. Yeah.
So I've got that. So the wires go down there. You can't see the wires at all. And the only thing you notice is obviously the incision where they did the operation. But under the skin, you can see it. If I pull my arm back, there's like a square thing. It's not massive at all. You don't even feel it. But they always put it on the left, because if you're driving a car, the seatbelt goes over the right if you're in the UK. So it may be different in different countries.
Oh, that's interesting. I wouldn't have thought of that. Yeah. Okay. And so you mentioned that this cable and the neurostimulator as well, and the pulses of essentially electricity or stimulation, and they can be adjusted for an individual patient?
Yes, they can be. Now, because I've had this nearly 10 years now, I've got a device where I can program it to certain parameters within a safe voltage, because the neurosurgeon and the neurologist at Salford Royal are very aware of what could potentially harm the brain, so they would never go close to that. So what they've done is they've enabled me to use the patient programmer to fluctuate up and down by 2 points, and you can go 1/10 of a point as well. I think it gets more complicated when you look into the ohms and the voltage and the amplitude and all the details, but that's kind of what it is in a nutshell.
Okay, so they set a range and you can actually adjust it yourself. When would you adjust it? When you feel your tics are bad, or?
Well, no, because so with myself, this may not be the same for everyone who takes deep brain stimulation, but for me, results are normally seen. I normally get maximum effects within 4 to 5 days, but it still takes a good month or a few months to bed in fully. So when I first had the operation, I had the settings on for 6 years, same settings. And it wasn't until I went back a number of years ago and got it tuned up slightly, because my tics started to recur back again. And because there's not a lot of research done yet in terms of the effects of DBS on Tourette's, they believe, based on the research I've done with Parkinson's, that sometimes your brain can adapt to the current setting and can start to overcome. It's human nature, we adapt to everything we can do, really. So they tuned that up slightly, and it wasn't until a few months ago that I had a full recalibration of the settings, because my tics did start to return again. And from the recalibration, they've calmed them right down dramatically.
That's so interesting, isn't it? So, I mean, is it the case then, so you're on a kind of higher amplitude or a stronger?
No, it's because there's 4 electrodes on each side. So this time I've got, because I don't know the settings off by heart because it is quite technical, but I've got different electrodes on each side with different frequencies. So you can, I mean, the combination of settings can go hundreds of thousands if you think of 4 electrodes each side, and you can range from 1 to 10 on 3 different elements. So it's endless, a combination.
Okay. But the adjustment that you do at home on your own is if you're feeling that your tics are mounting again.
Yeah, so I can adjust it up or down, but I can make the right side higher than the left or the left higher than the right. So I can adjust each side up by 0.2 within the current setting parameters. And
this might be a bit of a daft question, but if you adjust one side, does that affect the tics on that side of the body or all of the tics in general?
Well, truthfully, I didn't really know what to expect. And all I knew was the fact that, because there's not a lot of research done into this, the fact that I can't damage myself. So when I first had the recalibration done, 5 days after, I then turned the right side up by 0.2 and then back down again, the left side 0.2. And what I found is the right one made me a bit more focused, but everything went a little bit more grey. And the left side, when I adjusted that up, I went a bit more, I don't think euphoric's the correct word, but I felt lighter and the tics calmed down. So what I found with myself is if the left side's higher than the right, that benefits me a lot more.
Okay, wow. So that's really interesting. So you're saying that you almost feel more focused when you're getting the setting right. And when you don't have the setting right, you said you feel a bit grey. What, can you tell me a bit more about that?
So if the settings are wrong, I mean, for me, you kind of get a tightness impulse around the chest initially when you first tune it up, and then you feel low and you feel really agitated in the pit of the stomach. Now, that's how I kind of describe the sensation you get before any form of tickle leashes. You get that urge, that kind of agitation. It always starts on the pit of my stomach with myself. And when that starts building up, it's just an awful feeling. So you become so deflated because all you can concentrate on is that agitation. And that's, for me, this operation got rid of 95% of that agitation. The frequency is a hell of a lot less. The actual output of the tics are a hell of a lot less, all by 95%.
So it's actually affected the premonitory urge. That's the official name, isn't it, for that feeling, that building feeling before a tic. So it's actually calmed that urge down.
Completely.
Wow. Gosh, that's great.
Changed my life.
So listen, we've got to quote some risks as well. And, you know, this is your individual experience, so people listening need to be aware of that also. And there are complications that can happen. And, you know, it is, I guess, it's a foreign body, something foreign being put into your body and under the skin. So infection is one of the worries. Placement of the electrodes into the brain, if there was bleeding or you know, stroke or some kind of other medical event that could happen during surgery, of course. And there's also the possibility of the device itself or part of the device breaking, moving out of position, or malfunctioning, and you might need to have it repositioned. So those are all things that need to be taken into account. And I would imagine that you have quite a process. There should be quite a process with sort of multidisciplinary teams involved. So maybe a neurologist, a psychiatrist, all those kind of healthcare professionals on your way to kind of assess if this is something suitable for you. And they spoke about the risks as well, I guess. Can you tell us a bit about that time?
So that lasted up until the surgery. It was around 3 years of different meetings that I've had to have with Salford Royal. So it was quite intense. We had to do a number of tests to analyse how my movement was, my mental state. I had it drilled into me kind of how long things would take and what the process would be when I came into hospital. And for me, nothing dampened me off whatsoever, because ultimately I knew I wanted to have this done because I wanted to take any chance I could of giving myself a little bit more of normality, or making myself be who I wanted to be, who I was inside, but I couldn't because, and forgive me if it comes out wrong, but Tourette's is a part of me, and I think I won't be here today without Tourette's. That being said, the other side of Tourette's can, what I felt, stopped me achieving my full potential, because I know I'd never be where I was today if my tic's really bad. I mean, the specific job I've got, I'm advising other healthcare organisations how to adopt innovation to increase clinical outcomes. And this conversation now, if I didn't have this DBS operation, it would have took me best part of 4 hours to get what I've already spoke out.
Okay.
So in terms of that process, it was a lengthy 3-year process. The operation, I've never looked back. That was the best operation I've had. I've had a number of operations, excluding DBS, but that was the best one by far.
Right. And when it sounds like you've made up your mind quite sort of early on that this is for you, and you were on that path. When you were sort of very much closer to the surgery, did you have fears? Did you feel apprehensive about it?
So the only bit of nervousness I got, because this operation was obviously different to the others that I've had. So I got to Salford Royal it was 6 o'clock in the morning, and I didn't come round till I think it was 9 or 10 o'clock at night when I was woken up. But when I was in the actual surgical room being prepped and having the anaesthetic put in, I looked around and there was say 15 to 20 doctors all in white coats looking at different machines. I thought, Gordon Bennett, this is a big operation. That was the only nervous element that I got. But it was the best 12 to 14 hours sleep that I've ever had in my life. That's all I'm going to say.
So you were very, very fast asleep in recovery afterwards for those hours, for sure.
Yeah.
And we mentioned your parents earlier, that you sort of withheld until pretty near to the operation. What did they think, or what did they say to you when you told them about this?
Well, my father was on holiday in Gambia, so I ended up calling him and just letting him know that I've had this done. And he goes, "Oh, you're feeling all right." He was quite concerned, but obviously he was speaking to me, and he heard I was all right, so that was fine. My mother, because at the time I didn't have a strong relationship with my mother, but I told her I was having this done, and she was very supportive of myself. She says, "As long as you're comfortable in yourself that you're doing the right thing, then I will never hold you back." Okay.
So they were supportive. Maybe a bit apprehensive also, but in the main supportive. And so on the day of the surgery, how did you feel the day after the surgery? I mean, in the weeks that followed, how was the recovery that you were experiencing after the operation, after the implant?
So I woke up after the operation with something called the stun effect, which is quite common, where it's 2 weeks, up to 2 weeks, where you don't have any twitches. And I remember sitting up in bed, because they can't turn the stimulator on straight away because the brain swells. I didn't have a headache or any pain. I woke up, I was in my own private room, because you have to have that with brain surgery, risk of infection. And I sat up, I thought, hang on a minute, I can talk, I can move. And I was walking around, I thought, this is the most relieved I've ever felt since I can remember. And it was almost as if I had been given a new life. I actually came out, I was speaking to the nurses, I was able to hold down the conversation, I was moving, I could brush my teeth simply. I felt like someone had given me superpowers, that feeling. And that lasted for about 12 days. And after 12 days, between 12 and 40 days, you normally go back in to have the battery configured. Now, for me, the programming of the battery in the computer is probably the worser of the feelings, because what they do and the process that they take is they'll turn each electrode on to the maximum setting and lower it down. So they can see, does it work on max? Does it work lower? Trying to find the right one. Sometimes put 2 on, sometimes 4 on one side. I remember some of the side effects, because that lasted for about 3.5 hours, the programming. But some side effects, I thought I'm going to faint. I may be a little bit sick here, and my palms, my hands were sweating. I couldn't feel anything, but weird things were happening. And when they found the right setting, the calmness, and this was something about the agitation in my stomach before the tics just completely disappeared. I thought, oh, this feels brilliant. And I thought I was going to go into shock because I felt that good, but I was okay. And after that, they found the right setting. I was 7 days and I got something called euphoria, which for me was a good thing because most of my life had been grey and just so stressful. And I was just so happy. Everything excited me. I did struggle sleeping, and it was about 6 nights that I didn't really go to sleep at all. And then on the 7th night, I just collapsed. I fell asleep for 12 hours, woke up. It was brilliant ever since.
Wow. So, I mean, have they told you that, you mentioned this stun effect and then some euphoria. Was that something that they told you about, or you were expecting, or you just kind of dealt with it when it happened?
Well, funny enough, I mean, because they seemed extremely experienced at Salford Royal. So they mentioned when I woke up that you may have something called the stun effect as I woke up, which I did do, which was fantastic. And when they got the right setting, it was Professor Silverdale at Salford Royal who said to me, because you could see I was beaming from the face, I was extremely excited. He says, let me know how you feel in the next few days. If you get really excited, just be conscious of this, because when you get euphoria, one of the things is you want to help people out, give people money. That's one of the things you do with euphoria. You just want to give everything away and make sure everyone else is perfect because you feel so suffice in what you've got. You don't need anything else. So I said, that's not a problem. So it made me aware of that. And I knew I was getting really more excited as I left Salford Royal when I got the bus back home, which I shouldn't have done, but I did. And just, I can't even begin to tell you that the feelings from there, it's still to this day, I can remember how I felt and the kind of the relief from how I was before to now. The contrast is black and white completely.
And that's maybe a kind of, once the euphoria, etc. had passed, there was this feeling of well-being because your tics were so much more under control. So once you got over those, I guess, side effects of the operation and into a kind of normal setting, then you still felt a great feeling of.
Oh, I still get a great feeling today because I can wake up and do what I have to do and what I need to do without any thinking of, well, I've got to add another 3 hours onto this, or I've got to do it this certain way because my tics won't let me. So none of that has to cross my mind anymore. Now, there was a couple of situations because my current battery is rechargeable. So the first battery you get lasts up to 5 years, which isn't rechargeable. It's a 5-year battery life. Mine got changed after 2.5 years because I was on quite a high setting. So they changed that, and I've now got a rechargeable one, which lasts up to 15 years. Okay. So the way I have to work, I plug a device into the wall, but that's to charge a device up, and the device just has a cable with a round disc, which is electromagnetic, a bit like you've got a new Samsung phone or iPhone, you can put it on a Bluetooth mat. Similar principle to that, where you just hold that on your chest on the battery and it charges through the skin. You don't feel anything.
Wow, that's incredible. So, I mean, we're talking about these kind of psychological effects of having this procedure done. I mean, at the time when they switched the simulation on and since having it, I mean, did you feel like a physical? Did you feel buzzing or?
For me, it felt like I had a lot more energy in all my muscles because a lot of my time went like dealing with the agitation and then twitching, having to get rid of it multiple times, to the case that I used to be tearing muscles and I couldn't even let it repair because I was constantly flinging my arm out. And you twitch more when you've ripped a muscle. It's mental the way it works. But I felt, because I wasn't dealing with that agitation, I felt that I wasn't really using my muscles to the full potential, because obviously you're all the time moving them and then you weren't doing. So I started at the gym and I started doing a lot of weight training, and that changed my mental state as well, because you became much more happier because you could see the difference the way you looked. You weren't twitching and you were getting a body that you wanted. So for me, it was a win-win in all aspects. I could play guitar again. I could get jobs which were, let's just say, much more beneficial to where I wanted to be as a person. So it's those sort of things. I mean, still to this day, I still get the same feelings today. Yeah,
I can see when you're talking about it. It's quite an emotional thing in a way, that it's been so life-changing for you. So I think that's really interesting to hear that story. And I know that there will be people who might be interested in this, of course. And just before we were having this discussion, I asked on social media if you know, if you could ask somebody who has had DBS for their tics some questions, what would they be? So if you don't mind, these are from social media, but somebody was asking, I think we've said already, but they're asking about, wasn't it scary that they were doing a brain surgery? It's very dangerous. Weren't you afraid you might not be able to do something afterwards if they made a mistake during the surgery?
So there's a philosophy, well, I don't know if it's a philosophy that I've always gone on, and it's about regret. The biggest form of regret is regret of not doing something rather than regret of doing something. And for me, because I think a lot of it, you have to analyze in your own mind, what's the pros and cons. So the con for me was do nothing and live the same way with no guaranteed change in my future. The pro was take the surgery. I know there could be some risks out there, but I am at least decided to take a step that could give me the light at the end of the tunnel, which it has done, and more so.
And I guess as part of that, you know, long sort of 3-year process, the healthcare professionals are telling you about the risks so that you're absolutely aware when you...
Yes. You know absolutely everything under the sun. And even on the day of the surgery, if you don't feel comfortable then, they will not force you to go through with it. They make sure that you know more about the surgery and what's happening to yourself than most likely anybody else in the world will do, because they're drilled into you so much of what you're going to expect. That being said, there's one thing which I didn't realize when I had the surgery is the actual procedure. When they were doing it, obviously they cut you open in the head. They explained that, and they drill sort of 2 5 or 10 pence piece size holes where they put the rods in. I had no pain, but they also put like a casket on your head, which makes the when you put the rods in, because it's not done by hand, they want to minimize risk, so it's done by a machine. Now, I didn't realize the casket was bolted on, so I was picking at the scars. So I've got scars at the back of my head now because I didn't realize the casket was on. So, but ultimately, that's the only thing. Everything else you're fully aware of.
Yeah. Okay. Another question, which is really excellent, of course, is did you find that there was an improvement across all of your tics, or did you still have some afterwards? Or could you say, was there a difference in the tic severity, or was it the frequency, or both?
Reduction in the agitation before tics. I know you give it a specific name, Seonaid. I can't remember what the name was, but
that's the urge to tic.
The urge, yeah. 95% reduction in the urge, 95% reduction in the frequency, and 95% reduction in physical. And when I had verbal, I used to do a bit of a shout. All of that was reduced by 95%. The one thing that wasn't, and what a lot of people look past, is kind of your thought process. I've always had rapid thoughts, and they've stayed the same. So I've always struggled sleeping. I still do now, but either way, that's the only thing.
So on all motor and vocal tics, it worked, and on all parts of your body, and in terms of intensity and frequency. I think that's a really interesting point that you're talking about there, and it might, I guess, come under the heading of co-occurring conditions. So another question that came up was, you know, did this have any impact on your co-occurring conditions? Can someone have deep brain surgery and expect their comorbidities or co-occurring conditions to change, or is it just really focused on those tics?
So I think that does vary for person, because once I had the deep brain stimulation operation, it was such success. I know there were 6 other people that had it for myself, because I did some seminars and Tourette's meeting. Those 6 people didn't see a difference to some degree. It wasn't done the same way as mine, from what I'm aware of. But now I know there's going to be a much more effective clinical trial with 100 people, which I know you've alluded to, Seonaid, on previous documentation. What I do in terms of expectations, that's a tricky one, because everyone's different. And I think ultimately, if the current state of your Tourette syndrome is causing you problems which medication isn't solving and it's really, really affecting you, then a consideration is the best place to start. Consider what the possibilities are. You're not guaranteed any possibility. I don't think you are with anything, but ultimately it's changed my life, and I'm so happy I took that chance.
Yeah. And so would you say then, just to be really clear, you know, we're not really expecting deep brain stimulation to change somebody's ADHD, OCD, sleep problems, and those other things. And it could help with anxiety and depression, I guess, if it's related to how bad your tics are. But it's not really going to affect those other conditions?
Well, I've always had a certain degree of OCD. Now, I still get certain elements, but other ones have kind of calmed down dramatically. Now, I don't know if that's because I've had children myself, so now I can change a nappy, because before I had children, I just couldn't even, and before the surgery, couldn't go near anything that smelt or looked awful. I'm still really funny around bathrooms. I've got to clean before and after I go, but it seems to have calmed down a lot since I had that surgery.
Okay, so maybe it has dampened down some of those. They're still there, but they're maybe a bit less severe than before. Okay. Somebody also asked, were there any unusual side effects that you kind of weren't expecting? And you spoke about the stun effect. I think that's pretty interesting, but anything else that you...
So the way that I suppose the way that I saw the world had changed, but that could be down to the fact that all of my, well, 95% of my twitches and that feeling had completely disappeared. So I no longer looked for the negative side of everything. Everything seemed that I was looking from the universe at a different angle. I saw possibility rather than blockages, if that makes sense. Mm. And that, I think, that is possibly one of the most important side effects of this surgery. So I know it's the secondary side effect because it comes from potentially relieving the urge to twitch and the tics and the agitation. But that is the ultimate goal. It's getting you to see things from a different perspective, a perspective where, yes, I can move forward, I can do this and the other, and I never thought of it this way. I think that's the way that everyone has to move forward in life.
Yeah, I mean, I think especially if the tics haven't responded to medication and no other treatment, and they might be painful and causing a lot of damage and just really affecting your functioning on so many levels, then it may be worth looking at this for adults, obviously. And I think the research is, like you said several times, there's still so much research needing done, looking at when it can be effective, why is it effective perhaps in one person, and then you seem like the kind of gold standard here. Not only has it helped your tics, but it's helped some of the co-occurring conditions also, and allowed you to feel like you're really living a fuller life. But I think there's still the research is needed to work out why it works so well with some people and not with others. And I think there still also seems to be some differences and lack of consistency between research clinics or projects where they may be putting the electrodes in slightly different target areas of the brain. I think there's still a lot more information that needs to be gained. So hopefully we can keep discovering it. And you mentioned that there will be a clinical trial sort of starting, so in the summer of 2021, for adults with Tourette syndrome as well. So we support that, and hopefully this video will give people a chance to hear from an actual patient, their perspective as well, and think of some questions to ask their healthcare professionals when talking about it as well.
Exactly. And I just wanted to make it you aware, Seonaid, if you've got any contacts and they want to know more or want some direct conversations, I'm happy to be part of that. If you facilitate a call or you want anyone just to get some reassurance from yourself or ask me potentially some more, I suppose, more personal questions about it, so it's not broadcast publicly, I'm happy to respond to all of that.
Yeah, we could do like a Q&A or webinar or something with people that are interested in asking you directly. That's really great, Jason. I think that's fantastic. Well, I want to thank you so much for speaking with me today and being so open about your experiences as well. And I know that this will be really interesting to a lot of patients as well. So thank you so much. Hopefully we can have that webinar perhaps in the future as well, where people can ask you questions. So that would be great.